The baby
Oh!
as it exits the mother's body.
Oh, damn.
Before we fully remove the baby from the birth canal, we need to make
Oh, you can't even see it, can you? Because I have to censor it. Whoop. That was quick. Oh, that's damn it, like cocoa. I thought she queefed. That totally sounded like a fucking queef. Just that fucking sigh of relief from the womb, like, god damn, that baby been in there a long time. Hey guys, welcome to Bunglehole Does Surgery. Yeah, today we're delving into the fucking vagina. I'm sure there was a more delicate way I could have approached that, but I mean, come on. This is Bunglehole. She can't help but be real. You know this? Wait, speaking of being real, they make me look smarter. Now then, let's fucking do this. Hands first. Surgery squad, natural birth, blah, 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 blah. Birthing process where you are in control. Is anyone ever in control when a baby is happening? Something tells me this is setting false expectations for a future birth. If I have a child, I don't know. Who knows? One day I maybe push a human out of myself. It'll be good to know why I go on with that, I guess. You know you poop yourself, right? You poop on the table. They don't tell you that. No, they never tell you that. But it's true. Ooh, I wonder if it's going to be Jeff or Sujet. I hope it's Jeff. We need penis. We need penis. We totally need penis up in this vagina. What? No. Delete whatever you heard. Come on, Jeff.
Welcome to Parent Point.
Who the fuck
I'm
are you?
Dr. Rachel, OBGYN, and I'll be walking you through an interactive natural childbirth today.
Who the fuck is Rachel?
As a doctor,
it's a baby.
is the most remarkable thing.
So look at that hairy prune. Sorry,
Childbirth
Rachel.
is the same from woman to woman.
I'm listening.
Each birth is still unique in its own way.
Some people...
Did you know that more than 2/3 of all babies born in the United States are delivered vaginally? And average costs for a vaginal delivery without complications in the U.S. range from $6,000 to $10,000. Whether a woman chooses to deliver vaginally or through cesarean section,
that is
commonly referred to as a C-section,
a visual.
I always recommend that my patients do their research and make an informed decision based on their personal medical history and circumstances.
I mean, it's
natural childbirth is the process
of beautiful. It's a beautiful
process. Intervention.
But goddamn, is it disgusting?
In the birthing process.
Giving life, but
most doctors find this approach to
a
be
lot
the
of blood.
All
right, Rachel, let's get the fuck on with this show.
Crap.
Do we have to spread the labia? I have no idea how to birth a child.
And 10% post-term.
Vaginally.
Most women go into spontaneous labor.
Spontaneous
labor? Typically lasting from
God, look at that last one. What is this? What is that? What?
The beginning of labor, which is
cervix? Cervical mucus. Oh,
the cervix.
God, why is this
the next stage
already making me queasy? It's the natural, beautiful thing, Monica. Keep that in mind.
That connects the developing fetus
oh,
to
damn, it's a placenta. Oh,
waste elimination,
looks like a fucking octopus.
That's
graphic. I'm going to have to censor that.
Now that we've covered the basics,
God damn it, YouTube.
Deliver a baby.
It's a beautiful, natural thing.
Today, stronger and closer together. She's in her 39th week of pregnancy. So this baby is ready to enter the world.
Give it me in mums, lady.
A fetal monitor will be used to
what?
make sure mother and baby are doing well
She's
during
been shaved.
labor and delivery. 2 electrodes are placed on the mother's abdomen to monitor the baby's heartbeat, as well as the strength of her contractions.
Do I have to do this? God damn.
In addition, a blood pressure cuff will be applied to check the mother's blood pressure.
There is a lot happening
Our
already.
patient and baby are doing fantastic.
Great.
Let's feel the patient's stomach to check on the baby's position.
Check what indicated. Okay. Poke you. Let me poke. Oh, that's its butt. And that's its head.
Great.
Is it
we
breech?
can feel that the baby is positioned to come out head first.
Head
so
first?
You do not have to worry about a breech birth.
Oh.
That is, where the baby is positioned feet first.
Oh, you mean butt first. Yeah.
No, our patient's water just broke. Now the amniotic sac is broken. We need to get our patient to assume the birthing position.
Oh, God. What does that even mean?
We can see that her cervix is effaced and fully
Oh, God. Oh, it's the baby's hair.
So we are transitioning into the second stage.
Really?
Our patient is now having some painful contractions, so she is doing the breathing exercises she learned in her prenatal classes. Remember, since she has chosen to
Lamar,
have a
right?
totally natural birth, we won't be administering any pain medication.
Girl, you crazy.
Okay.
Oh, damn! That is a real looking vagina. Oh, channel your inner Nicki Minaj. Oh! Oh!
Occasionally,
Oh, damn.
forceps or a vacuum is needed to help ease the baby through the birth canal.
Look at your
You're
face!
doing okay right now.
Okay, don't poop yourself.
However, going to help us
You gonna be fine, girl.
hand.
She got like
This will
ginger
provide
pubes.
added space for the baby to come out.
And her butthole is just hilarious. I have to click the vagina? Is this what you do in real life? What if I don't do anything? Would a baby die? What if it tears? What do I do? Look at her face. Oh my god, stop moving the screen, girl. You're so unprofessional. Yeah, that's right. You can do this. I'd be so great as a birthing coach. You know it. Oh. Oh, your finger. Oh, he all up in there. Oh, now the other side. Oh, it's just, oh. Oh!
The baby
Oh!
as it exits the mother's body.
Oh, damn.
Before we fully remove the baby from the birth canal, we need to make sure the umbilical cord isn't wrapped around the baby's neck. Fortunately, in this case, it isn't. Let's let the baby turn to slip its shoulder out.
Oh.
The rest of the body will follow.
I can't do this. This is fucking horrible. It's not horrible. It's a beautiful natural process. But it's also a really scary prospect of the future for me. What if one day I have a human coming out of me like this? Help pull the baby from the birth canal. Sounds totally normal. Oh, 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 oh. Oh, you can't even see it, can you? Because I have to censor it. Whoop. That was quick. Oh, that's damn it. Like, oh, I thought she queefed. That totally sounded like a fucking queef. Just that, like, sigh. Just that fucking sigh of relief from the womb. Like, god damn, that baby been in there a long time. Oh. Oh, I don't know what's wrong with me today, but this has made me weep. It's so beautiful. What is with, why is the vagina just in the background? Click where indicated to remove excess fucking cervical fluid from the baby airway. Alright. Oh, it's right up there. It's just, oh, okay. The birthing noise wasn't as bad. Ooh.
We're almost there. Clamp and cut the baby's umbilical cord in order to detach it from the placenta.
You know what? I'm tired. I mean, just watching this birth, this fake birth was hard enough. Not gonna lie, guys, it's kind of scary. Click what indicated. Okay. See?
It's a baby boy.
This is the easier part.
Nurses will clean off the baby, but we're not done yet. An APGAR test will be performed on the infant. The APGAR is a test performed at one. The doctor, midwife, or nurse will assess the baby's breathing, heart rate, color, reflex response, and a score ranging from 0.
God,
others are with the mother
that would freak me out. Imagine just that coming out of you. Oh,
birth,
God.
The placenta is delivered. Removing the placenta requires just a pushing by her new mother.
What? Oh, oh no! Oh no!
The cervix or vagina during birth, we would suture them. But in this case, our mother is fine. Sometimes a doctor will perform an episiotomy, which is a common practice in which the mother's vaginal wall is surgically cut during the second stage of labor to provide a large baby to pass through the birth canal more easily to avoid excess tearing. After birth, the cuts are sutured. Great job! Now the recovery process for our mother begins.
Oh my gosh.
Most mothers are able to walk and care for the baby 2 hours after birth.
Oh, isn't it beautiful?
It is ideal for both the mother and baby to spend time together and bond. One way the mother and baby will bond is through feedings. If the mother has chosen to breastfeed, the nursing staff will assist the mother to make sure her baby latches on and feeds as soon as possible.
Gotta get that nipple down.
Breastfeeding is the preferred option, but several factors may make bottle feeding the feeding method of choice.
That was...
A pediatrician will examine the
That was
new baby in
intense,
the
guys.
hospital
That was
to make sure
intense.
he is doing well.
I'm out
And
of
in
breath.
a couple of weeks, we'll want to see the baby in his or her office.
Whew.
A healthy mother and baby will sometimes
All
be
right.
discharged from the hospital
Rebecca
the day
or
after
Rachel,
giving
whatever the
birth.
fuck your name is, I'm over it.
Suggest that new mothers
over
have
the baby
assistance with
thing.
chores following childbirth.
Conclusion. Oh, God, I'm not even
Natural
at the
childbirth.
conclusion yet.
Amazing, isn't it?
Yeah,
When
totally.
they get imagined. They'll also lose more than a little sleep as they adjust to the baby's schedule. Thanks for stopping by Parent Point and helping bring a new life into the world. Why not check out the other exciting parenting information and procedures that we have to offer here on ParentPoint.com.
Why are you just staring at me, bitch? What is your issue? You ruined my life. I will never look at another vagina the same way ever again. Well, in conclusion, isn't the vagina a magical thing? So is Eliane. Push a fucking cumin out of it. A root canal. This looks like fun. People fearing is one of the worst things I could possibly experience. Alright, let's do this. Let's fucking do this, Bunglehole. We haven't done anything with the teeth. It's about time we, broaden your horizons, girl. Whew. I'm still recovering from the birth givings.
Welcome
Jeff.
to Surgery Squad's
Just the
virtual
man I
root
wanted to
canal
see.
procedure. I'm the one and only Dr. Jeff,
Fuck right
and I'll
you
be
are.
helping you with this surgery today.
Thank you.
A root canal is inside the tooth and seal it to prevent any further infection.
Tell me more, Jeff.
Before
Alright,
we
let's
begin,
get the fuck on with
would
it.
you like to review some of the common myths and misconceptions surrounding root canal treatment?
No.
No problem. Let's move on.
Let's fucking
In
do
effort
that.
to make our
Just
patients
fast.
as
Come
comfortable as
on.
possible, we
I
need
wanna
to
do
inject
that.
a local anesthetic into their gum line. But first, apply a topical numbing gel to the injection site.
What?
This will help reduce any discomfort the needle may cause.
My dentist never does that. They just inject straight away. What is this pussy ass business? Do it. God damn it.
Next, we can inject the local anesthetic.
Can we now?
After the local anesthetic has taken effect,
Come on
the
in.
area should become numb for a few hours.
Mm-hmm.
Use the syringe to inject.
Did you ever get your one side of your face numbed at the dentist and then flare your nostrils, but only one of them flares? Did you ever do that? That's funny. That's fun. That's entertaining for 2 minutes. Now stab this bitch. Oh, his tongue flinched.
Let's give our patient a few minutes to relax
No,
and
let's
for
not.
their mouth to become completely numb.
No, let's not. That third-rate porn music. Yes.
Now that the patient's mouth is numb, we can move on to isolating the tooth. Since our patient's saliva contains contaminants that we don't want getting into the tooth,
No.
isolation is a critical step during root canal treatment.
Yes.
To isolate the tooth,
Come on.
we need to punch a small hole into the rubber dental dam and place it over the tooth.
Rubber dental dam. Let's do it. Let's do it. Come on.
Once the rubber dam is in place, put on a tooth clamp to keep it from moving.
Tooth clamp. Sounds pleasant.
Next, we'll need to dry out the tooth as much as possible using our air-water syringe.
A water syringe. What does that even mean, Jeff? Ooh.
So far, so good. Now that the tooth has been isolated,
Why do they dry
we can
it?
create our access cavity in the tooth using our drill.
Oh no, this is the drill part. Brace your starfish. It's the high-pitched noise that just...
The next step is to clean and shape the tooth's canal using a root canal file. Go ahead and give it a shot.
Fucking file. Got a file inside the tooth. I'm gonna penetrate the tooth and file. Are you shitting me? Well, what about the nerve? What is going on with the screen? What about the nerve, though, Jeff? Oh, no, I don't like them sounds. That was nasty.
At this point, now we need to clean the canal of the tooth using sodium hypochlorite, commonly known as bleach.
Sounds great. Sounds amazing. Bleach cleaning. Yeah, it's bleach on your butthole.
We'll let the
Sounds
bleach
like
sit in our patient's
pouring a
tooth for
boob-
about
a
5
boob.
minutes
Someone's
to
pouring
make
a boob.
sure that all the bacteria and tissue inside the tooth has been dissolved.
Really? No groovy porn music?
Great.
Fuck you then, Jeff.
Now use the suction to remove the bleach from the patient's tooth.
There's no way you got all of
Next,
that.
you'll need to fill the tooth using a rubber compound
Fucking
known
liar.
as gutta percha.
Gutta percha.
Gutta pert some sealant to the gutta percha cone. Let's see what you can do.
Cones? We're putting cones in there? There's a fucking stick.
Looking good.
What?
A heated instrument is now used to remove the excess gutta percha.
Ooh.
Pack the gutta percha into the tooth canal using a plugger.
You're just making this up as we go along now, Jeff. Now we're putting a fucking toothpick inside the... Is that why they call it a toothpick? Because it ends up inside your fucking tooth. Did you get a picture? Yeah, right. Jeff, whatever. I was shaving it. We're totally shaving it.
After the gutta percha has been
sure.
placed, it is common that additional...
There's
Here
a hair
on
removal of someone's back.
surgerysquad.com.
Maybe one day, but not today, Jeff. Like I said, I've had enough... It's enough excitement for one day. Not gonna lie, right? But that birthing one was graphic. Like, just a tad real for my liking. Them pubes, the tinge of the ginge in the minge were triggering. Fucking the whole thing was triggering. The only thing that I was disappointed about, though, really, was the fact that she did not poop. You know, you don't even have to mention it. Just a little dookie that you can see. And then it just fades away into the background. Like, yeah, it happens. Sometimes people poop, but we just move on. We don't pay it any attention. We just wipe that shit up and move on. So yeah, I'm gonna adopt. It's fine. I had no idea that that's what a root canal was. And they put a toothpick. I thought it was just like kind of like a removal of a tooth that was rotten and nasty. But apparently not. It's just a cleaning of the inside. And then you put like toothpick in there, there's scaffolding. I don't know. The epidural, whatever it was called. Guttadural, I don't know. This whole thing was rather disturbing. Think happy thoughts. Think happy thoughts. Think of balloons and cakes and Cara Delevingne. What? Sure. Anyway, guys, I might end this video here because shit's getting weird about the minute. I don't even know what's going on anymore. If you enjoyed this video, hit the like button. Share, like, subscribe, mate, and all that fun stuff. Share, like, subscribe, comment, and favorite. You can favorite. But I'll see you in the next video. Okay? Take care of yourself now. Bye. Oh, Yandere Sim style. Fucking kill a bitch. Oh, look at you. Yas, with your man thong and your afro. Where the fuck are you going, ho? Oh, yeah. Bitch in the bathroom. Pass out in the toilet. Fuck you. Yeah. Stab this motherfucker. Oh, I'll kill you too. Fuck it. It's fine. Yes! Goals in life achieved, people. That's right. Choke on my shit. Oh my god.